Well, 2020 has finally come to an end. Everybody's favorite year, we can finally say, is behind us. And I wanted in this video to look at some numbers here because probably the biggest topic of 2020 has been the pandemic. It certainly affected all of our lives here in the United States and around the world. And there's been a lot of debate about it. I've covered that on this channel. There are people that are really making a huge thing out of the pandemic and making it sound like it's the bubonic plague and we're all going to die. That's almost the impression that some people give. But on the other extreme are people who downplay it and who would say, no, there really is nothing here. It's just all hype. It's something that the media is making up. And I know I have people in my audience that maybe tend toward both sides of that and a lot of people in between. I wanted to look at some numbers here though, and I know people will dispute these numbers and say different things about them, but I think we need to just take an honest look. It's always good to look at what numbers are out there and just to do the best assessment we can. And I think it's really fascinating. The CDC is saying here that there have been over 19 million cases of COVID in the United States. In the last 7 days, though, there has been another 1.2 million cases. So that's an incredible increase that we're seeing right now, which really doesn't surprise me. We're getting into flu season, sickness season. We're getting into the thick of it. And so it's not surprising to see a rapid rise in illness. But the total deaths they're reporting are over 341,000 deaths. And this is the reporting as of the end of 2020. So when you look at those numbers there, I don't know how you perceive them, but clearly what they're saying here is that this is a very serious illness that has had very far-reaching, staggering effects, and that's what these numbers are telling us here. If you look at this article here from the New York Times, the headline here is, 2020 was especially deadly. COVID wasn't the only culprit. And what this is showing here is that there has definitely been an increase in the number of total deaths in 2020. Some people have disputed that, but the numbers they're showing here show an increase in death. And it says the year 2020 has been abnormal for mortalities. At least 356,000 more people in the United States have died than usual since the coronavirus pandemic took hold in the country in the spring, but not all of these deaths have been directly linked to COVID-19. They are saying here that more than a quarter of deaths above normal have been from other causes, and they list various illnesses that people have died from. It goes on to say some of these additional deaths may have actually been due to COVID-19, but they could have been undiagnosed or misattributed to other causes. Many of them are most likely indirectly related to the virus and caused by disruptions from the pandemic, including strains on healthcare systems, inadequate access to supplies like ventilators, or people avoiding hospitals for fear of exposure to the coronavirus. So they're saying there that it's not just the coronavirus pandemic that has caused a lot of death, but even residual effects of the pandemic that is also causing an increase in death. So this is the picture that is being painted, and I know there are people that would dispute this, but again, I'm just trying to look at what the numbers are actually saying. And it says on the CDC website, and this is actually, I think, from 2018, that the number of deaths in 2018 was 2.8 million deaths. So we could just say before the pandemic in a normal year, we'd have around 2.8 million deaths. And now we have, I think they said 356,000 more deaths. So if I did the math correctly, we're looking at about a 13% increase in deaths. So that certainly paints one side of the picture. That is really bad. Also, if you look here specifically at how people died in 2018, you will see that influenza and pneumonia is a significant cause of death. So this is important because when you go over here to last year's flu season, you can see that there were 62,000 upwards of 62,000 deaths attributed to the flu. But there were 56 million cases of the flu. So the flu is something we deal with every year, and it does actually cause a lot of illness and death. And something I was thinking about is that if you think about 56 million flu illnesses, and then we've had actually close to 20 million COVID illnesses this year, that just shows you we are dealing now with a lot more sickness. So I realize that, and there's certainly a point to be made that well over 99% of people, or at least 99% of people, will survive COVID-19. But we are talking here about a 35% increase in something like the flu. I mean, the flu already creates problems, and we have a vaccine for the flu, and we've dealt with the flu in our population. But we're now talking about a new disease that, on top of the flu, you're talking about a 35% increase in illness during the flu season. If I'm understanding these numbers correctly, 20 million cases of COVID on top of the 56 million cases of the flu. So of course you're going to expect a lot more death just because of the increase of disease. But also on top of that, you have a disease that we haven't been exposed to, that we don't have as much immunity to. We haven't had a vaccine for until recently. And so it's going to spread a lot more easily and have even a lot more impact. So that's why I think you see these extremes. In some ways it is like the flu, but it's like the flu to an extreme where we don't have as much immunity. We can't fight it off as easily. It spreads more easily. It impacts people more aggressively. But on the other hand, we do have very good medical technology and the ability to handle things. So you still are seeing the vast majority of people survive COVID-19. So I think this gives us a clearer picture of what's happening. What I've kind of taken in my position is that it's something we should take seriously, but we have to take other things into account. We can't let this dominate our thinking and our lives. There are other things besides COVID-19 that affect our health and well-being, and that includes just the health of our culture as a whole, and how we can operate as a society. That certainly impacts all of us. But I think it's wrong to go to either extreme. It can be dangerous to go to either extreme, because if we say it's not anything at all, I think we could be ignoring some significant things here that the numbers are telling us. So anyway, I just want to be honest, share these numbers, give some of my thoughts. I thought it would be interesting because this is looking back now at last year. We get a little clearer picture as to what the numbers actually are. I know people are still going to debate this, and feel free to talk about this in the comments. But my hope is that we can all just come to a better, clearer understanding of things and make the wisest choices possible for ourselves, and also seek to move forward in the ways that are best for others as well. But thank you so much for taking a look at this subject with me and listening to some of my thoughts, brought to you from A Frisch Perspective.